How are you? How is your sex life? Do you have pain? Do you have orgasm? Do you have enough lubrication? And I think that Genevieve, as a non-surgical approach to helping those symptoms, is something that I've been waiting for a long time to offer patients.
Which leads me to my next question, which is, what are these symptoms that you're looking at, or that we are looking at, to come to you and say, hey, I need this treatment because of...
Yes, great question. So basically, there's a few things. The first is probably lubrication. A lot of people feeling that they're drier. A lot of people feeling that post-vaginal delivery, they have some laxity of their vaginal walls that makes intercourse not as pleasurable. There are a huge amount of studies now out of Canada that actually also show improvements in stress incontinence. So a lot of people
Meaning
really...
like
urinary incontinence, correct. Coughing, sneezing, laughing, all of these things.
Stop laughing.
Stop laughing. Stop laughing, or have Genevieve. But I think that there's so many reasons that people might be interested, but it doesn't come up in conversation.
Right.
And the only way it'll come up is if people know that there's something you can do.
Right.
Because I think historically it's just like, yep, deal with that.
Yeah.
You know, it's okay to feel
And
dryness.
in general, for women, that's the case. So we are sort of living in a culture where it's like these little memes and blurbs about balance and balancing in your life, and all of what it takes to be balanced is you have to talk about the things you don't want to talk about.
Agreed.
You know, so people come in, they don't want to ask the questions. They don't want to say, I have vaginal dryness.
Right.
You know, and you have to take that away. You have to remove that stigma so that people are like, we all need to feel complete. We all need to feel whole, and we all need to have health in all of these parts of our lives. And if you are missing that one piece, as opposed to looking at it like, oh, well, it's not that important. It's, you know, it's sex. It's like, it's fine. All of it is important because that is balance. So that blurb you see about balance, that is part of it, is having everything connect.
Absolutely. To just know that emotionally and physically you can be in sync. Okay, and that this treatment really can help improve all of these concerns. And we definitely target, I think, women who are post-vaginal delivery, but it can really be for women who are postmenopausal as well, who just over time, our vaginal walls become a little bit more flat as opposed to sort of full of estrogen and full of kind of what we call rugae, sort of waves. And with that removal comes decreased sensation. And so Genevieve...
what does the treatment do?
So what it does is it's cryogen-cooled monopolar radio frequency.
Nice.
Okay?
Mouthful.
A mouthful. And a fancy way of basically saying that as we're heating deeper layers of the vaginal tissue, we're actually cooling the really fragile surface mucosa. So that translates to a comfortable procedure with minimal downtime, which is really, really important. So you're getting a depth of like 2 to 3 millimeters of heat, but we're cooling at the same time.
There's no pain.
There's no pain. And that's important because the procedure is about 30 minutes long. And so you need to know that during that procedure you're comfortable. That we are listening, that the device actually delivers the same amount of radio frequency to each client, but that the provider listens to what you tell us about your concerns, whether it be female sexual dysfunction, whether it be urinary incontinence, and we target the location of the treatment based on what you tell us.
Oh,
so
that's good to know.
Yes, so you're getting a tailored treatment to what your complaint is.
And people need to know that you deserve it. You know, it's so hard to convince someone, like, you deserve to be happy, you know?
Absolutely.
And we sacrifice for our families and for our children, and we're like, I'm going to be a martyr for just a little bit longer. And this goes on until before you know it, you're like, wow, I have a lot of things that feel unsatisfying to me and I didn't even realize. And it's like, you deserve it. And you should be happy. Like, you should do the things that make you happy. And obviously something like this, people don't even know they have the option.
Exactly. People don't know they have the option, or they think it's a lot of downtime. So, okay, I have children or I have a career. How do I fit this in? You fit this in a 30-minute office procedure. You're not in pain. You can go straight back to work. You could, in theory, have intercourse that night. If you want to wait a night, you can, but there's no reason that you need to
Medically.
because of the cooling. So you're not in pain, or you're not, having any issues with discomfort. And as far as the peak time to notice what you've done for yourself, about day 30 is when people really start to notice that collagen has started to become restored. You've really started to have some regrowth. About day 90 is when you've got the full treatment on board. And
You only need one treatment.
that's what the studies show. They say that the longevity is about 12 months, so that if you ever wanted to repeat it because you loved your results, you could. However, you don't have to. So I think everyone's different in that sense, but the longevity is definitely 12 months or more.